All right, let's dive into a topic where every single second is absolutely critical. We're talking about a true medical emergency, bacterial meningitis. And this really is a story about a high-stakes race against the clock. It's a pretty scary question, right? One minute, you feel like you're just coming down with the flu, and the next, your life is hanging in the balance. It's that incredibly fast, devastating escalation that makes understanding this disease so important. So let's break down how that happens and what you really need to look out for. So what is this really? Well, think of it this way. Bacterial meningitis is basically an all-out assault on the protective cushion around your brain and spinal cord. These membranes, called the meninges, are your central nervous system's last line of defense. When bacteria get in there, they trigger this massive, dangerous inflammation. And that's when the timer officially starts. And here's what makes it so tricky. It's sneaky. The very first signs, what doctors call the prodromal phase, well, they look like pretty much anything else. You might have a little cough, a runny nose, nothing that screams emergency. Not at first, anyway. Now, while this can happen to anyone, some groups are definitely more vulnerable. You've got the very young and the very old, whose immune systems just aren't as strong. Any kind of head trauma can literally open a door for bacteria to get in. And of course, anyone with a weakened immune system is at higher risk. Even where you are in the world can matter, especially in a part of sub-Saharan Africa known as the meningitis belt. Okay, so let's get into the most important part. How do you spot the moment things go from just feeling sick to a full-blown crisis? Because recognizing these signs and recognizing them fast can change everything. In the ER, they look for what's called the classic triad: a high fever, a headache that's way worse than anything you've ever had, and a stiff neck. That's nuchal rigidity in medical terms. It basically means you can't touch your chin to your chest. Throw in photophobia, where even normal white is painful, confusion, and sometimes even seizures, and you've got the picture of a brain in serious trouble. The big takeaway here: a severe headache with a fever and a stiff neck is not something to ignore. It's an alarm bell. But here's where it gets really tricky, and this is so important to know. In an older person, you might not see any of those classic signs. No high fever, no complaints about a stiff neck. Instead, the big warning sign might just be sudden confusion or extreme lethargy. It's the same deadly disease, but it's presenting in a much more subtle and honestly a much more dangerous way.
50%. What's that about? Well, in about half of the cases caused by one specific type of bacteria, Neisseria meningitis, the body throws out a very, very clear visual clue. And this is that clue. If you ever see a rash that starts as little red dots and then turns into these dark purple splotches that look like bruises, that is a 5-alarm fire. That specific rash is a classic sign of meningococcal disease, and it means you get to an emergency room, no questions asked, right away.
Okay, so you've made it to the ER. The alarm's been sounded. Now a new race begins, the race to get a definitive diagnosis and to do it as fast as humanly possible. The medical team kicks into high gear, following a very specific playbook. It starts with a quick neuro exam, checking for any signs of trouble. At the same time, they're drawing blood cultures, trying to catch the bacteria red-handed. Then comes a really important fork in the road, which all leads to the gold standard test, the lumbar puncture, also known as a spinal tap. Now, this is a really good question, and it's not just about procedure, it's about safety. See, if there's a huge amount of swelling and pressure inside the skull, doing a spinal tap can actually be really dangerous. So how do they know when to hit the brakes and get a scan first? Here's the safety checklist. If a patient shows any of these signs, if they're in a coma, if the optic nerve is swollen, if they're having seizures, it's a sign of dangerously high pressure. So they'll get the antibiotic started right away, but they'll get a CT scan before that spinal tap, just to make sure it's safe to proceed. And once they get that spinal fluid, wow, the story it tells is crystal clear. Just look at the difference. Normal fluid should have almost no white blood cells. In bacterial meningitis, the fluid is cloudy, and it's absolutely swarming with thousands of them. Protein levels go through the roof, and the glucose, or sugar, it tanks. Why? Because the bacteria are literally eating it. It's the definitive fingerprint of the infection. Okay, diagnosis is in, or at the very least, it's strongly suspected. There is absolutely no time to wait. The mission now shifts to an immediate, aggressive counterattack. This quote really says it all. You ask any doctor, read any textbook, this is the #1 rule. You just don't wait. Delaying antibiotics, even by an hour, can be the difference between a full recovery and a devastating outcome. This is a really important idea called empiric therapy. It just means you start treating based on your best, most educated guess. You can't afford to wait a day or two for the lab to tell you exactly which bacteria you're fighting. So the second those blood cultures are drawn, powerful IV antibiotics are started.
And that initial choice of antibiotic is anything but random. It's specifically tailored to the patient. For most adults, a heavy hitter like ceftriaxone is the go-to. But for someone over 50, you'll see they add another one, ampicillin. And that's because they need to cover for a bug called listeria, which is much more common in older adults. It's a calculated, life-saving strategy.
But it's not just about killing the bacteria. It's also about managing the collateral damage. The body's own immune response creates a ton of inflammation, so a steroid like dexamethasone is often given right around the first dose of antibiotics. The goal is to calm that inflammation down, which can make a huge difference in preventing long-term problems, especially hearing loss. So the immediate battle is fought in the hospital, but the story is far from over. We have to talk about the aftermath, because even with the best care in the world, this disease can leave behind serious, lifelong challenges. This chart is a really sobering look at the reality of the situation. The outcome can really depend on which bacteria caused the infection. For Neisseria meningitis, the fatality rate is around 3 to 13%. But for others like strep pneumoniae or listeria, it can climb to over 25%. I mean, think about that for a second. That's a 1 in 4 chance of not surviving even with modern treatment. And for the survivors, the fight often continues. That inflammation can cause permanent damage, leading to things like a lifelong seizure disorder, permanent deafness, a dangerous buildup of fluid on the brain, or lasting cognitive problems. The impact is it's profound. And because some of these bacteria can spread from person to person, the response has to go beyond just the patient. For meningococcal meningitis, public health departments will actually track down everyone the patient was in close contact with, and those people will get preventative antibiotics to stop an outbreak before it can ever get started.
We've seen the incredible race to diagnose and the all-out fight to treat this disease, but it all leads to a much bigger question, doesn't it? The real win isn't just about getting better at treating it. It's about preventing it from ever happening in the first place. And that, of course, brings us to the crucial role of vaccines.